Good afternoon, everyone. If you're watching this recording, it means we had some sort of technical difficulties, and I'm unable to be there with you live, so we've pre-recorded this session as a backup, and I'm happy to be here with you in travels of time and space. And if any questions arise during this presentation, I'm sure that Lilith and Matt would love to field those, and please feel free to get in touch with me at any point after the program. So I'm going to be demonstrating today and talking through the concept of evidence-based marketing from the perspective specifically of how do you include the scientific literature in your communication with clinical professionals. So you've probably heard the term evidence-based practice, and there is certainly a long movement now in medicine toward evidence-based practice. There is some misunderstanding about what exactly that term means. It's not solely the incorporation of scientific evidence, although that is a portion of it, but there are a few concepts within evidence-based practice that are all critical. So the concept of evidence-based practice does not suggest that you should use the scientific evidence to guide your practice to the exclusion of everything else you know and think. It does include the use of the evidence as one piece of information. From a yogic perspective, we're using lots of different ways of knowing to guide our practice. And the body of scientific evidence can be one of those ways of knowing, along with the teachings and our mentors and our training and our intuition and our own experience and all of that. So in evidence-based practices, we want to include clinical expertise and expert opinion. So that is, a mentor is a prime example of that, someone who has been experienced in your field, who has a lot of information that they've gathered over time, strong depth of training. You want to incorporate that in the choices and the way that you practice. 2 is scientific evidence, and we'll get to that. That'll be the focus of the presentation here today. And then 3 is including the perspective of the people that you're working with. So that's being sensitive to the person that you're communicating with. And in this case, we're going to be communicating with clinicians. But in our practice, certainly we're being sensitive to the needs, expectations, and perspective of our clients. So that certainly yoga therapists reflect very strongly. And we want to be doing all of this in our practice of yoga therapists, but we're going to be talking today about how to use these 3 pillars, and specifically the scientific evidence, in the way that we communicate verbally and also through written word with colleagues and potential collaborators. So evidence-based practice, or evidence-based medicine, is what it's often called in the practice of medicine for us as yoga therapists. It would be evidence-based practices. Evidence-based medicine is often called EBM, and in this case, we're going to be talking about evidence-based marketing. So when we create materials, are they reflective of that philosophy of using not just what we know, but the existing evidence? And when we're doing that, we're including in those materials our own clinical expertise and those of others. We're including the scientific literature, and we're including an understanding of the audience we're communicating with. So there's a list on this slide here of some of the types of populations that you might be creating materials for in order to foster greater collaboration and referral networks. This is very different from materials that you would create for your potential clients. And we'll talk about some of those distinctions. First, I want to be very clear that the state of the yoga evidence is not strong and robust in the way that the evidence is for a lot of medical procedures, practices, medications, etc. When we talk about the existing yoga evidence, and this is true in keeping a scientific perspective in general, we want to downplay how much we know. how much we know based on the scientific literature. When you overstate what is known, that is a red flag to a clinical audience who is always operating from a point of being skeptical until further evidence exists. And really in science, we think about it as an iterative process. So there is no such thing as a definitive study. Well, there have been a few, but in most cases, it requires a preponderance of evidence in order for us to really have a strong understanding of a relationship, an association, an effect. So certainly the few small studies that have been done looking at the effects of yoga on any given condition or any population are not going to be sufficient to make strong conclusions or to particularly to prove anything. And we're not in the business of proving anything in science. We're in the business of gathering more information to better understand how things are associated and how they operate. So the limitations of the yoga evidence as it exists are, number one, that the studies are small. And that has to do with a long history of yoga research happening outside of Western medical research. And even within Western medical research, we've been looking at yoga on the side as an interesting question. It's only been in recent years that there have been large, rigorous, multi-center, expensive studies conducted to investigate the effects of yoga. So when you look into the evidence, you're going to see a lot of studies with 20 people, 30 people, 40 people, even 6 people. And the more people you have, the more information you have about how yoga is impacting some of their outcomes. So the smaller the sample size, the less that we can understand from that particular study. There's also something called statistical power. In order to see a relationship that exists, you'll need a sample size or a number of people in the study that's large enough to be able to see that pattern. It's like trying to look at a puzzle and having only 5 of the pieces on the table. The more pieces you have, the more you're going to be able to fill in that larger picture. So when we're looking at some of these smaller studies, they're what we call pilot studies. They're a study that's done just to see, is this feasible? Is it safe? Is it acceptable to the population? Would breast cancer patients be interested in practicing yoga? So it's looking at some of those factors that are going to determine whether it makes sense to invest in a large multi-center trial. We can't draw any sort of conclusions from a small pilot study except whether or not it's worth it to do something larger. So we want to be looking at that when we consider the evidence. Also, there's often a lack of control groups in yoga studies. So if we take 10 people and we measure how they're feeling, let's say their level of depressive symptoms, and then they practice yoga for 10 weeks, and then we measure their depressive symptoms again using a tool that's been validated to measure depressive symptoms, and there's a change. There are many other factors aside from the yoga that could have impacted their level of depressive symptoms during that time. So a good example would be if during that 10 weeks, spring came upon us, right? That would affect people's level of depressive symptoms, particularly for anyone who might have seasonal affective depressive disorder. And I think lots of people's moods are lifted in the springtime regardless. So that's one of the reasons why we have control groups, to be able to compare what happens in 10 weeks for people who do practice the yoga and what happens in 10 weeks for people who don't. So in the case of having a comparison group of people without yoga, you'd be able to see that when spring sprung, everyone's moods got a little bit better, and you'd be able to see, well, what was the difference in the yoga group? So that's something that's lacking in the yoga evidence as well, is not having control groups. And also that the interventions or the yoga programs that we're using are very diverse. So they come from a lot of different lineages and traditions. Some of them are 1 hour once a week. Some of them are a 5-day retreat or practice 3 times a week for 90 minutes. Some of them have only asana. Some of them are only breathing practices. So if we gather a bunch of research studies together looking at the effects of yoga on a condition, we might be looking at apples and oranges. So that's something important to consider as we're looking at the evidence. And also, we're measuring a whole bunch of different things. So even if you see multiple studies looking at the effects of yoga for breast cancer survivors, one study might be measuring depressive symptoms, another study might be measuring range of motion. And so you can't conclude anything on a summary of evidence if they're all looking at different pieces of the elephant, so to speak. The yoga evidence, while it is not where we'd like it to be, it's really exploded in recent years. This is something that I quickly created to look at the amount of evidence for the use of yoga in people with arthritis, which is my wheelhouse. And this was just a quick search. It was by no means exhaustive. I went into PubMed. I'm going to show you this in a couple of minutes. And I just typed in the search terms yoga and arthritis. So there are probably other studies out there that I would find if I went to different databases or if I searched with different keywords. But you can see on the bottom, so I can use this here, looking at clinical trials. So that's a paper where a study was actually done. People received yoga and something was measured. You can see that, now there's my cursor. So we only had 2 studies in this literature before 2000, and these are 5-year blocks. So every 5 years, there are just a couple more. And then in the last 5 years, we have 11 studies being added to the mix for a total of 18. So that's a big growth area from prior years. And these are randomized controlled trials. So this is what I was talking about before, where you would randomize, that's the R, who's going to get the yoga and who's not going to receive the yoga, because we want to make sure that there are no inherent differences between the groups. And there weren't very many before 2000. But then when we get down to the past 5 years, again, we see an explosion in that area. A review study, and this is something we'll look at, a review is a paper that gathers all of the existing evidence. So every few years, it's useful for scientists to look at the state of the evidence so far. What do we know based on all of the clinical trials that have been conducted up to this point? So every few years, if the information is growing steadily, we'd want another review paper that's going to say, okay, now that we have a little bit more information, we can say that the state of the evidence is moderate for these particular outcomes. We can say that it looks hopeful that there might be an effect in this area. So you can also see that in the past 5 years, we've had more review papers than we've had any other 5-year period, for a total of 60. And this is true not only of yoga for arthritis, but also for many different populations and conditions that we're seeing rapid growth in the evidence, and not just in the amount of evidence, but the quality of the evidence. So when we look for this evidence that we're going to be using in our materials, how do we go about doing that? First, we want to have in mind what we call a PICO question. And PICO stands for Population, Intervention, Control, and Outcomes. Now, when we're going into a search, we're not going to be looking at what the control might be. So a control would be, for example, if we're going to compare yoga to talk therapy or cognitive behavioral therapy, or if we're going to compare yoga to an education group or to a walking program. There isn't enough evidence for us to get that specific in our searches, but we will be looking at what's our population. So people with arthritis, what's our intervention? Yoga. What are our outcomes? We may or may not want to specify the outcomes. So you might be interested specifically in what the effect is on fatigue, but for our purposes today, we're just going to look at the population and the intervention, the effects of yoga in a particular population. And I'm going to switch over to a view of PubMed so you can see how we narrow down our search and get to the evidence we're looking for. So I'm going to close this and switch over to PubMed here. Now, in order to get to PubMed, I just type PubMed, and it brings up this screen. So let's use this example where we search yoga and arthritis. There's automatically an "and" added in between here. And we'll search, and this is where we come up with the 60 example that I showed you before. But these are not all research studies. These are all sorts of papers. Some of them might be a perspective of an individual clinician. Some of them might be a case study of one individual. Some of them might even be a call for more information or a letter to the editor. So we want to narrow down our search in order to find, oh, look, there I am, to look for the type of evidence we're trying to find. So article types on the left here, these are going to be all the different kinds of studies. So we might want to specifically look at review papers where we've gathered a whole bunch of evidence together, and we would just click that. And then here we are, we have all of the existing review papers. We can clear that filter. And maybe we just want to look at clinical trials. But let's even get more specific and look at the highest quality of clinical trial from a medical perspective, which is going to be the randomized control trial. And let's see those. Okay, so there are 12 randomized control trials. Now, text availability. We certainly want to look for papers where the full text exists. Free full text is going to allow anyone to access the paper regardless of their affiliation with an institution. There are some biases and limitations in looking only at the free full text, and I'll get to that later. So let's just look at papers for which a full text is available. And so automatically we're going to be looking at humans because I don't think we want to look at yoga in dogs at this point. And maybe we're going to look at adults because arthritis in kids is a different set of conditions. Okay, so here are our 10 papers. And we can see just the titles here, the authors, the paper that it was published in, the year, and you can customize that you want only recent papers. But we're also going to, instead of looking at the summary, we're going to look at the abstracts. Okay, so now we can actually see a description of each of the studies in more detail. And the next step would be to do what we call abstract screening. And I'm going to get to that in a moment. I just want to show you something called MESH terms. So MESH stands for medical subject headings. Okay, and this is where you figure out what keywords are being used in the literature. So if we type the word yoga, we're going to come up with this term, and we're going to see when we use yoga as a term, what does it actually mean in this database? And here is yoga is a subset of a variety of different categories. Well, let's see, what about the term arthritis as a MESH term? So this can give us a refined idea about what terms we might want to use when we search. So there's arthritis as the broadest category of arthritis, and then there are all of these specific terms, and maybe we want to look at psoriatic arthritis or we want to look at reactive arthritis. If we click on that, it tells us exactly what is meant by the term reactive arthritis and also some other terms that we might use. So if you're not finding exactly what you're looking for or you want to be really comprehensive, you could also see that here reactive arthritis is a subset of spondyloarthropathies, of spondyloarthritis. So you can see a tree here of what's included. So when we pick the term arthritis, we're including all of these in it. And if we want to get more specific, we can. We could even get broader and use joint diseases or musculoskeletal diseases when we search for terms. Okay, so we're going to go back to the slides so that I can talk a little bit more about what we do when we're looking at this evidence. I mentioned considering filters, not only the publication date we can search by, we can look only in the core clinical journals, which are the most reputable, most well-read clinical journals. You're going to see less yoga literature there, but if you conduct a search and you find 100 papers, you might be able to be that selective and narrow it down to the most reputable papers and consider other keywords. And the use of an asterisk just will include any ending on a particular term. So if I put ARTH asterisk, it would include arthritis, arthritic, so that you can include multiple endings. All right, let me switch views here. When we look at all of the abstracts, we want to make sure that the abstracts even talk about the subject that we're searching for. No matter how refined you get with your filters and your search terms, sometimes there's going to be a paper in there that's not relevant to your question. And then what type of paper is it? We want to be looking at actual research studies or review papers. And then how do we decide which of these studies is actually going to be compelling to a clinical audience? We want to look at the title. Does it sound clinical? Does it sound woo-woo, as medical doctors might think? So does it seem reasonable and appropriate when they look at the citation? Is it going to make sense to them? Is it recent? So if it's from 1983, that's not representing the strongest state of the evidence right now, unless it was a very large, really rigorous and well done study. Is it in a reputable journal? Is it in the Journal of Yoga for Cats? If that's the case, then that's going to be seen in the citation, and that's very different from a study that's published in the British Medical Journal, for example. You can look at journals by impact factor. So impact factor gives us a sense of how many people read that journal and the strength of the journal itself. So if you're trying to decide between two equally strong papers from different journals, you could look at their impact factor and see which one is going to be better recognized and more well read. The type of study it is it a pilot to just assess feasibility, a randomized controlled trial, etc.? We talked about sample size and even the institution and authors when we're looking at what's going to be credible from a medical perspective. Now, this is very different from what papers might we actually use to inform our practice. We might be looking at a very different set of criteria. This is what papers are going to be reputable to a medical audience. And we want to be looking at the whole paper so that we can understand what happened in the study, which means getting the full text. And so this is what I hinted at earlier. Open access means that the paper is free to everyone. It's easy to get to. If you don't find it in PubMed, search in Google Scholar or in other databases. You can also get it by subscription. So the International Journal of Yoga Therapy, I hope that you all receive. And you can also, if you have a membership with IAYT, you can look at all of the back issues. And then go to your affiliated institutions, your alma mater, your spouse's alma mater, a local university where you can go on campus and go into the library, ask people that you know who are in academia, because I do believe that the knowledge that we gather should be available to everyone. There are creative ways to get to it, and you're going to be much better informed if you read the whole paper before using it in your materials than if you assume that the abstract is an accurate representation of what the study says. You might be intimidated by trying to read some of the papers, and that's a whole other subject that we can get into. I hope that research literacy gathers steam in the yoga community. But in the meantime, at least look at the intervention. What exactly did they do? From your clinical perspective as a yoga therapist, does this seem reasonable? Does it reflect the kind of things that you would be doing in practice? Do you think that the conclusions are reasonable based on what you know happened? Read the discussion where you'll get the reflections of the researchers themselves. What did they conclude? Make sure that what you're putting in your marketing materials accurately reflects what was represented in the study. And know at least enough about it so that if a medical practitioner asks you about it or mentions it to you, you have some familiarity with it. We want to be looking for studies that have statistically significant differences or statistically significant changes over time. That shows an effect. It shows an effect of yoga on depressive symptoms, for example, and we look at that in two different ways. One is with the p-value. There is p minus 0.05 is the standard that we all agree as a scientific community that we're going to use. So when a p is anything less than 0.05, it means that the change or the difference between groups is statistically significant, meaning a difference was seen. And there is a 95% chance that there is actually a difference between the groups or over time. And another way to look at statistical significance is a confidence interval. If you're comparing the mean value on two scores between two groups, so let's say we're going to compare how long you can stand on one foot. If the confidence interval, which is going to be a range of numbers, if that crosses 0, that means there was no difference between groups. There was no difference between the people who took yoga and the people who didn't in terms of how long they can stand on one foot. Whereas if it's a ratio, this proportion of people could stand on one foot for 30 seconds or longer. You don't want the confidence interval to cross 0, or else that means there was no difference between groups. So and you'll look for those words that it was a statistically significant change or a statistically significant difference. That means that something was found there, a difference was found. When we're creating our materials, we want to consider the population, which is going to be clinicians. And when you're talking about a medical condition, be very careful not to explain the medical condition in your material. This is targeted toward people who already understand the medical condition. I have my students in the master's program do this assignment, and a lot of times I'll see a brief explanation of what the medical condition is. Instead, present to them how you can help with some of the challenges that this population faces that are not as well met by all of the wonderful medical treatments, pharmacology, surgery that exists today. Medical providers acknowledge that there are gaps in what they're able to accomplish and what their treatments do. And yoga can fill some of those gaps. For example, you can spend time with their patients. You can provide them with the level of attention that a 7-minute primary care return visit doesn't allow. You can help engage challenging patients who are having a lot of symptoms that are unresolved, for example, or have larger life challenges that can't be addressed in a medical visit. You can help them to find modified ways to do things that might be appropriate for whatever their limitations are, and offer guidance about how their lifestyle can help to ameliorate some of the effects of the medical treatments that they're using, like the fatigue associated with chemotherapy, for example. And to do some things that can actually help to make the medication more effective. So when we look at changes in lifestyle that might be address a lipid profile, that doesn't mean that they don't take the medication, right? So we want to be working integratively. We want to be working with the medical community, not instead of. And ideally, we're in strong collaboration and communication with the medical providers, understanding that they provide something that we don't, and we provide something that they don't. So certainly in your materials to that population, you want to be speaking collaboratively and supportive of the importance of what they do, as well as how you can help them to solve some of the challenges that they face clinically. Try to avoid use of Sanskrit when you explain what you do. So this is another component of your materials. What exactly are you going to be doing? There are some clinicians who've had experience with yoga, and maybe they've taken yoga classes that would not be appropriate for their patients. Maybe they're a fit young medical doctor who goes to power yoga every Saturday morning and sweats like crazy, and maybe they work with people who are immune compromised or who are connected, who are using oxygen. So you want to make sure that you can show them that yoga is not only one thing, that there are many ways that yoga can be practiced that would be safe and appropriate for their audience. Explain what it includes in a way that is understandable in plain English instead of pranayama. Certainly we'd explain that we use breathing practices. You might even explain what those are. So deep breathing, deep diaphragmatic breathing, these are terms that they would understand that would help them know what is it that you're going to be doing. Their main concern is going to be whether or not whatever you provide is going to be safe for their patient population, and do you understand enough about their population to work with them safely? And lastly, what might yoga accomplish in terms of outcomes for this patient population? So do we actually have evidence that yoga can help reduce fatigue for people who are in chemotherapy treatment? That's what you're going to find from the evidence. And I would say in these materials in general, keep it really simple. Doctors are very busy. They have a limited amount of time. You want to make this something that they can scan in 30 seconds and decide whether or not it's going to go in the trash can or whether or not it's actually worth a shift in their thinking or a referral to someone or further investigation. If you write in paragraphs, it's not going to get read. If you write in bullet points with images that are clear and informative, then it's much more likely to get a longer look. Cite everything properly. So you're going to make a point. You're going to say, for example, and I don't know if this is true according to the evidence, but let's say there's a paper out there on a reduction in fatigue for people undergoing chemotherapy. You would say something like, yoga has the potential to reduce fatigue for people in chemotherapy treatment. You would put a little citation, a footnote, and then at the bottom you'd have the full reference of the journal and the title. Use APA format or MLA format, a format that they can recognize, that they know you found this article and that what you're saying in the bullet point reflects what happened in the article. Use the highest quality of evidence and never suggest that yoga is a cure-all. Never suggest that yoga is able to prove or fix or cure or resolve anything, but that yoga may be helpful, might support, be conservative and cautious in your language. And lastly, in your materials, include who you are. So who is this person? Do they have the training and the experience to work safely and appropriately with my patients? That's going to include a short description of who you are, what your training is. Don't include lineages, names of teachers, but explain what your experience is with this population, what your training is with this population. Make sure that any images of you look professional, and include ways to contact you in a professional manner. Imagine that this is something that you might see in a medical doctor's office, not something that you might see posted to a cork board in the Whole Foods. Just some general cultural considerations when talking to this population that I mentioned already. We want to avoid suggesting, given the scant evidence that exists in the world of yoga research, certainly nothing is proven. Certainly our treatments do not cure, but they can help people to live differently with their limitations, medical conditions, ability levels, etc. Think integratively. We're hoping to create networks. If you refer to others, they would refer to you more likely. We want to be building communities of people who work together with the common goal of helping our patients and clients to live differently. Understate, don't overstate. Avoid any sort of lingo that they're not going to understand. They don't necessarily know what downward dog means. Consider images to show people who are like their patients in poses that would be safe and appropriate. Show them how things might be modified. And use terminology that makes sense from a medical lens. So we might metaphorically suggest things like, take a deep breath in and breathe out through the toes. We know medically that we are not actually breathing out through the toes, and that kind of thing is going to be a red flag to a medical provider. Talk with them about the kinds of outcomes that matter to them, the things that they are measuring, the things that they know that their patients are experiencing from a medical perspective. There's a whole lot to yoga that is outside of the realm of a medical doctor, and you can certainly engage your client population on their spiritual concerns and their spiritual journey, but that doesn't need to be part of the communication with their medical doctor. Stay within your scope. So the scope for a medical doctor is very vast, and they have concerns about other people practicing outside of their scope. So what you want to communicate is what your training and expertise is, and what you'll be doing with their patients within that wheelhouse and not outside of it. Be sure that the design of your materials looks professional and conservative and appropriate for a medical community. When you're creating materials for your client population, you're going to go through a very different process to think about what the design should be. Lilith is a master of this, and I'm sure that she would have more to say. But here are just some ideas that you want to make sure that it looks like something that was created by a professional printer. And here are some other opportunities aside from the materials that we're going to create that might help to foster better understanding between medical providers and yoga therapists about what we do. Think about referring, as I mentioned, when you come across an issue that is outside of your scope, refer to the appropriate provider. So if I see someone who has some symptoms that I'm concerned about that that might warrant a workup from a rheumatologist, I'll refer them to a rheumatologist. And that rheumatologist is going to know that that I'm being mindful and careful about what's happening with my clients. I'm being responsible. They're going to be more likely to refer someone to me who's very well managed medically, but maybe could use some help with taking deep breaths. Utilize their services. If you go to a massage therapist and you talk about what you do and how you do it, they might be intrigued and more likely to refer someone to you, and vice versa. Don't bombard medical providers with communication. They are overwhelmed. They're very busy. Provide them only with the minimal amount of information that's going to get your point across. Don't ask them to sign anything. So if you're working with one of their patients, don't send something and say, please sign this saying that you approve of this treatment plan, because to them, they see the potential for a lawsuit, that they're signing off on something that they don't really know enough about or understand. But what you can present is, here's what I plan to do, or here's the basic here are the basic goals of our work together. Please let me know if there are any contraindications or specific limitations or concerns that might be important as I go forward. Again, anything that you send with your client to their doctor's office should be really quick and easy to scan in a second and make a decision about. Provide progress notes. Again, we want those to be very brief. We want them to be in anatomical language, not in yoga language. Send the correspondence with your client to their medical visit so that your client can communicate directly with their doctor. If you send things in the mail to the medical office, there's a good chance that that's not ever going to be looked at closely by the person that you'd like to see it. Make friends within the medical community, and here are just a few opportunities, getting to know the office staff. And I know Matt has spoken about opportunities to, offer free sessions with the office staff or with the medical provider's spouse, or because that's how, when you're successful in working with one person, they're going to share the experience that they had and send more people your way. Medical offices are usually not utilized after hours. They have space that's being underutilized. The patients know where that space is. They know how to get there. They're comfortable and familiar there. That's a great space to conduct some yoga workshops or demonstrations or classes. The more you know about your population, the more trusted you're going to be by their medical providers, and the better you're going to be able to serve them. If you're working with a particular condition, I specialize in working with arthritis, know everything that you can about what it's like to live with arthritis if you don't yourself. Understand the current science, read the journals that are relevant to your population, follow scientists on ResearchGate, which is the social media for researchers where all of their new publications are presented. Go to scientific meetings, so not just the yoga scientific meetings, but the scientific meetings for your population. Get to know the other people who are working with that population, and find your nonprofit. So for me, that's the Arthritis Foundation. There are organizations that work with your population and have the same goal of helping them to live better, healthier, happier lives. Work collaboratively with them as well. There are a lot of misunderstandings between medical providers and yoga therapists that can create adversarial relationships if we don't create bridges between us. We have a common ground, and primarily that is that we both have the best interest of our clients and patients in mind in the choices that we make. We use different tools, but those tools can be complementary. instead of alternatives to each other. It is an underlying principle in medicine to aim to do no harm, just as we as yoga therapists practice ahimsa with our client populations. We all went into healing professions for a reason. We all want to help people to live differently. So think about that shared perspective, the commonalities between us more than the differences in your communication with that population. Okay, so I wanted to show you just a couple of examples of some materials that some of my students have created that represent what we're talking about here. So here's an example of yoga therapy for breast cancer patients. Now you do see there's quite a bit of dense text here, and the text is small. So you'd want shorter bullet points, but you do see that what she does here is she has a little superscript, and then at the bottom is the proper citation for the study, which is excellent. So this demonstrates that evidence-based marketing that we're talking about, where we're referring to the evidence. Here's her bio. I'd have a more professional headshot, good contact information down here. If you can have a professional email, even better. She's showing what it might look like to work with someone, giving an example of what yoga for people with cancer might look like. She has some quotes and testimonials, which is great, an explanation of what yoga therapy is. The images are high resolution, which is great. Again, I'd like to see an easier to read text and not as dense text, but this is an example of something that you might use to present to medical providers. And here's another one. So this is yoga therapy for fibromyalgia. Okay, this shows where her practice is located. I would avoid this sort of, flowers and nature images in favor of more clinical images that actually show what you'd be doing. But again, she has clear margin. She has text that falls within the margins. I see a whole bunch of stuff that does not look this professional. Again, I use a larger font so it's easy to read, and bullet points instead of, so this is a very dense text here. You might also be mindful that the medical community, I believe, is more understanding of how yoga could help their patients than they are with Ayurveda, which is a different whole system. So there are some medical providers who might be open to referral to an Ayurvedic professional, but yoga is going to be an easier sell. And again, we have the evidence here. Take out any hyperlinks. Put in a proper citation of the study as opposed to the hyperlinks for the study like we saw in the last one. And lastly, I'll show you one more. Here's another example. This is also a trifold brochure, but of course you could do this in lots of different formats. This is pretty easy to read as a testimonial there. It has the evidence cited properly. It has a really quick and easy bio, but I'd like to see just a little bit more information about who he is and what makes him qualified to work with this population. He has a website, that's helpful. And then let's go down to the back side. So again, bullet points would be great. If you can speak in their terms, outcomes that matter to them, non-motor symptoms, how results are measured, verbal dexterity, an example of a task that might be done, that's useful, an explanation of what yoga is and maybe what yoga therapy is in particular. You do not need to explain Parkinson's disease to the people who are going to be reading this, but it is helpful to remind them of some of the challenges that these patients face that you might be able to help with as a yoga therapist. All right, that's it. Thank you so much. I hope that you didn't have to watch this because I was able to work with you live, but if you did, then enjoy the rest of the session, enjoy the rest of the meeting, and feel free to contact me at any time.